21st International Workshop on Neonatology in Cagliari. We are with Professor Alketa Hoxha. She has just finished her talk and we want to ask her, could you distill the main findings of your talk? With the title was Prematurity in Albania.
Thank you all about invitation me in this meeting. Is not for me the first time, and every time I come with very joy to discuss with the colleagues about very important topics. For this year is prematurity in Albania. In fact, I choose this topic because it's a general problem, and what is something special but not for the good words, in the bad words for Albania, is the fact that we have not very exactly data, and I presented that we have different data in different sources. So this is a big problem related to the published data, but as neonatologists this is important problem for Albania because we have some challenges to do with the improving the neonatal mortality and morbidity in our country. So first of all, I mentioned that we have not until now the parenteral nutrition, so we have not good results in the very low, extremely premature babies is something that we miss. Another thing is about the metabolic screening, and the third thing is not a good follow-up after baby delivery from our maternity. So these are the three main topics that I discussed, but other things are we have a good relationship with the obstetrician department, and what I can mention in good words is the fact that we have a good transfers from the regional city to our tertiary university hospital in Tirana. We have two university hospital in Tirana, and so we have good results because the babies is better to transfer inside the mother womb than to transfer baby alone. So this is our main topics that I wanted to share with my colleagues. In Italy, we have a very good relationship, not only for the Congress, but and for the other activities, example, transferred baby in Italy, to have a better examination and treatment for some things that we don't do in Albania.
Will there be further steps in your research?
In my research, the further steps, I don't think is research than in action plan. So we are trying now to do the best about the electronic data, and we are starting, but we have not really results. So I think for the next year we will show real data, because this system is starting and will be functional during the next year and the other years. And the second, we are discussing with the Ministry of Health to follow up these preterm babies in our hospital. Is not the first time, because we have seen in most hospitals in the world, in the European countries, that these very risk babies, especially very preterm babies, to be following for the milestone, for the development, for all the things in a hospital, so we can have the network, the specialists, to do the best for these babies. And I think these two are now just in the first step, so this is a very good promise.
Professor Hoxha, thank you very much.
Thank you.